The future of health tech, in my opinion, is basically what we all carry in our pocket. So essentially what it is it's mobile, it's a cell phone. It's really the ability for not only the patient and the concept of connecting to your provider, but the providers themselves, provider to provider, provider to patient, have absolutely a different way to look at this. It's really driven by what we do on a daily basis with our mobile devices. It's how millennials use tools, not how we use desktop computers or email and everything else like that. We're stuck right now in an era in our healthcare systems where we're using archaic computer systems, desktop machines, everything is hardwired together. But the future is wireless, it's cloud-based, it's data sharing, and it's ability for us outside the point of care to interact with our patients and for our patients to actually do things such as self-diagnosis, do things such as consultations that don't involve patient visits, and also for us to take data that affects their life and affects their health, what we call social determinants of health, their economic status, housing status, environmental factors, things that will influence their health as much as any sort of disease state or genetics or anything that they have, that's really going to make a difference in how we care for them. And the way we're going to discover that and manage that is because we're all going to start to communicate more effectively with mobile devices. So we need to change even our user interface and our interaction to a mobile-centric approach. We essentially need to provide wireless medicine, basically medicine everywhere. And that's what's going to be the fundamental revolution, and it will disintermediate a lot of the things we do now and radically change how we treat patients. Now, this is also how we treat patients in the hospital, because our doctors are now using wireless devices and using smartphones, and all our monitors are connected to smartphones and cellular and stuff like that. The revolution goes all the way from the patient's home to the hospital. And then we can even start taking some of the patients we have in the hospital, actually treating them at home where they'd like to be, letting them die at home if they have chronic conditions and they want to rather than be hospitalized. And it sort of changes the social dynamic of what we do as well. So again, I think the future of digital health, or health itself, is basically what we carry around in our pocket, smartphone.